My name is Cathy Wilkinson and I work at Voluntary Action Rotherham. My role is the Mental Health Network Manager, and I've been building a network across Rotherham of voluntary sector organisations that support people with their mental health. I'd like to introduce Leon Wormley. Leon's the CEO of Functional Fitness, and he's going to tell you a little bit more about the group and how they help support people with mental health problems.
Hi everyone, my name is Leon Wormley and I'm the Director and Exercise Specialist at Functional Fitness. So we are a private company and we've been in existence since 2013, and we specialise in community-based rehabilitation for people with long-term health conditions. So what tends to happen is we work closely with healthcare professionals and acute services within the NHS. And when people have gone through for their rehabilitation, we tend to get them referred out into community-based exercise out with us in the community, which is a great transition. And basically, the way we've always positioned ourselves is directly after discharge. So as soon as the healthcare professionals are finished with anybody, for whatever conditions or whatever reasons they were in the GP practice or in the hospital for, we're there to pick up where they left off. And for us, there's generally an introductory offer depending on the level of investment or commissioning that is at that point. But as a business, the first 3 sessions are always free, and we always say to everybody, look, you know, you've got nothing to lose and everything to gain. Come and try, see what you think, and ultimately, because we're exercise specialists, so we are knowledgeable, we're experienced in those long-term health conditions, and whether it's blood pressure, diabetes, obesity, we've got all those other ailments as well that fall into the pathway. So people generally don't just fall into those square boxes. People tend to walk through that door with a whole host of problems. We try and meet everybody's need, but the ultimate goal for us is to build confidence, get people the support that they need, get them moving, feeling good about themselves, getting them out in community and group-based activities perfect, because they can, with the stuff that we do, it's all condition specific. So they're in and around the peers, other people with similar conditions, and they get that additional support as well. And we get it a lot that even sometimes people will openly admit that, Leon, you know what? I don't even like exercising. I don't even enjoy exercising. But I tell you what, I love coming to catch up with Margaret and find out what she's been doing over the past week. So that's the kind of stuff that we're there to do, and reinstate a bit of quality in people's lives.
What is the group called?
It's called the Community Tree.
And what's your name?
Dale.
And what do you do there, Dale?
I'm the chairperson.
Yeah.
So I'm the one that created it.
So you created it. What made you want to create it?
It was just, to be honest, it was a sermon in a church. It was just about getting out and helping the community. And then I was thinking, well, there's nothing here for anyone. And anything that we were doing, we had to go further afield. So it was like we'd have to go to Maltby or Brinsworth or anywhere. And I just thought, well, why not just start doing something? And then it's just progressed from there, really.
Yes. How many people now help you to run this group?
Approximately about 6 at the moment.
Yeah. And what does the group do?
So at the minute, we're just focusing on mental well-being, and we're going to start stepping into physical well-being as well. So we have a One Step Forward cafe, which is just a small place that once a week we do well-being activities. So we try and help you to see where you want to be in your life or what might be stopping you, and just general chit-chats and coffee and everything. And then Fridays is the crafty coffee. That is also a well-being one.
Yeah, and how do you think it helps people with mental health needs?
It's given us somewhere to go. And I know that there's plenty of people that come that do have mental well-being needs. They've said that it's brought them out of the house. Some of them were scared to leave the house, and over time they've managed to come down, and now they're actually part of the committee. And it's just, we give them a safe place. We don't judge them because we've all been there. We know how scary it is. We know the difficulties and everything. So we just open it up, and they're fine with it. They love coming, which is really nice.
So we can come.
Actually, anyone can come. anyone from anywhere. We are committed to helping and working with 40-year-olds and over, because we realise that children and elderly do get quite a lot of clubs going on. So it's really just for people that maybe their children have left home and they've gone to university or they've moved, and it's just they don't come out with the kids or anything because they just don't have the time now. So it was just that. So, but anyone can come.
So you're filling a gap
Yeah.
in the community. So if you also live in Rotherham, how to get involved?
Just turn up. Just walk through the door. We are a bit crazy. Like, we will jump on you because we just love everybody who comes through the door. And then we will try and get you involved with anything. So really, you just turn up on a Tuesday or a Friday. We're hopefully starting new groups up, like a sewing group, a book club, a games night, and etc. So whenever we've got something on, it is normally for mental well-being, mental health, and just turn up.